Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello's Sports Medicine Report. Today I'm going to go over medial epicondylitis. Medial epicondylitis is also known as medial elbow tendinopathy and forearm flexor tendinopathy. You may know it more by its nicknames, golfer's elbow and climber's elbow. Medial epicondylitis is pain on the medial part of the elbow and the forearm. It is where muscles that flex the wrist and pronate the forearm originate at. This is the medial epicondyle, which is located on the humerus bone, which is the large bone in the upper arm. Medial epicondylitis is an overuse injury. It is when the wrist flexors and the forearm pronators are overused. Medial epicondylitis is an overuse injury that responds well to conservative care. As a doctor of chiropractic, I see this in my office often, treating golfers and climbers. The symptoms of this condition include pain and tenderness just distal to the medial epicondyle and pain with repetitive wrist flexion and forearm pronation. Certain populations are prone to this condition. As I stated, golfers and climbers, but any athlete who performs activities overhead and any type of employee who performs activities where they are constantly gripping and flexing the wrist. This is a condition that is an overuse injury. Overuse injuries occur when there is too much activity and not enough rest between those activities. So if you think about an athlete, if the athlete is training too often, or if they are competing too often, and not giving themselves adequate rest between training sessions or between competitions, that is when overuse injuries occur. The muscles that are most commonly involved with medial epicondylitis are the flexor carpi radialis and the pronator teres. Although any muscle in that area can be involved with this condition. Most commonly, the muscles are the pronator teres and the flexor carpi radialis. Medial epicondylitis is about 1/3 as common as lateral epicondylitis, which is also known as tennis elbow. The mechanism of injury for medial epicondylitis is repetitive elbow flexion and pronation. This causes microtrauma to the tendons that attach at the medial epicondyle. If there is inadequate rest between training sessions, this microtrauma cannot heal. Therefore, it continues to get worse and the symptoms begin. As I mentioned earlier, the two most common symptoms of medial epicondylitis are pain and tenderness just distal to the medial epicondyle and pain with wrist flexion and or forearm pronation. Now, there are other symptoms also that can occur, and that is usually with resisted forearm pronation and resisted wrist flexion. Oftentimes when the symptoms begin, they are only felt during activities, and then they progressively become more frequent and they become more intense. Also, there may be weakness on the affected side compared to the opposite side. There may be a decrease in wrist strength. There may be a decrease in grip strength. Also, 20% of cases of medial epicondylitis develop cubital tunnel syndrome. Now, I have a video on cubital tunnel syndrome, but cubital tunnel syndrome is impingement on a nerve right in this area, and it causes symptoms into the pinky and this side of the ring finger. So you have to be aware of that. If you start to feel these symptoms, and you also start to feel symptoms of numbness, tingling, burning, going down into the hand where it is by the pinky and the pinky side of the ring finger, then you may also be getting cubital tunnel syndrome along with medial epicondylitis. A cervical radiculopathy can contribute to medial epicondylitis. If someone has an impingement on a nerve in the lower part of the neck, specifically C6, C7, and C8, this radiculopathy can cause weakness in certain muscles, and that can cause a strength imbalance and lead to medial epicondylitis. So conditions in the cervical spine, which is the medical name for the neck, can contribute to medial epicondylitis. Now is the time of the video for the disclaimer. I just want everyone to know, please, if you think you have this condition, to seek professional care. Watching this video does not take the place of seeing a medical professional. Please do yourself a big favor. See a medical professional for proper evaluation, diagnosis, and treatment. If you think you have this condition, do not hesitate. Seek professional care immediately. Never perform an exercise or any type of self-treatment that elicits symptoms or intensifies symptoms. If an exercise or form of self-treatment elicits symptoms or intensifies symptoms, you want to stop immediately and find an exercise and a self-treatment that does not elicit symptoms or intensify symptoms. If symptoms start to occur, you want to take action immediately and start your self-treatment and seek professional treatment. With the self-treatment, some of the main things that you want to do is modify your training. Give yourself more rest between training sessions. Modify the way that you are training. Check for any strength imbalances and train the opposing muscles. Say if one area is stronger than the opposite muscle, then train that opposite muscle. But you have to modify your activity so that you are getting a greater amount of rest between training sessions, and you have to modify your activity to correct any strength imbalances. You will want to seek professional care. Do not wait. As a doctor of chiropractic, this is a condition that I see in my office, like I stated earlier, with golfers and with climbers and with many other types of athletes also. But those are the two most common, hence the name, or the nickname I should say, golfer's elbow and climber's elbow. So if you start to feel these symptoms, please do yourself a big favor and seek chiropractic care. This will help to bring proper nerve flow to these muscles that are not functioning properly or are being overused. One of the self-treatments that you can do is muscle work on yourself. Now, whenever you do this, you want to use mild pressure. More is not better. And you want to do this very infrequently. Okay, you don't have to do it 100 times a day. You don't even want to do it every day. You can do it every other day, and it's going to help to reduce some of the muscle tension. What you want to do is you're going to use your opposite thumb, and you're going to have that thumb contact just distal to the medial epicondyle. You're going to flex the wrist and flex the elbow. You're going to keep the forearm supinated, and you are going to apply that mild pressure, like I said, just distal to the medial epicondyle, and you will slowly extend the elbow and extend the wrist, and then return to the starting position. Do this very slowly. Once you have completed one repetition, then move your thumb a little bit more distal, which is moving towards the wrist. Distal means away from the center of the body. And repeat. So you are going to extend the elbow and extend the wrist. and then slowly return to the starting position. And you could do this all the way down the course of these muscles. It is going to help to reduce muscle tension. So that is a form of muscle work that you can perform on yourself. And again, you want to use mild pressure, and you don't want to do it every day. You can perform it, like I said, starting just distal to the medial epicondyle and work your way all the way down the muscle, again with mild pressure. I cannot say that enough. Use mild pressure. But begin just distal to the medial epicondyle and work distally till you reach the end of the muscle. And then if you want to, you can work a different muscle, and then you're done. Give it a day's rest, and then after a day's rest, you can perform it again. You don't want to overdo it. If you overdo it, you can end up injuring yourself. Now, this is also a condition, like I said, you want to seek professional care. Do not self-diagnose yourself. Do not try to perform self-treatment without getting a proper diagnosis. Because if you do not have a diagnosis and you perform the muscle work, you could be causing further damage to the muscle. So get a diagnosis and ask your medical professional if performing muscle work on yourself is okay. Medial epicondylitis is a condition that can become chronic, it can become disabling, and it can also be recurring. So you want to make sure that you get professional care and that you are modifying your activities. Do yourself a big favor and get this condition taken care of before it becomes a chronic condition and prevents you from doing the activities that you need to do and want to do. Thank you, everyone, for viewing today's episode of Dr. Ozello's Sports Medicine Report. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book, and you could also get additional information through videos and my blog. Thank you very much for watching today's video. Please remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free and accomplish your